CAR T-cell therapy stands for chimeric antigen receptor T-cell therapy. So it is a kind of an immunotherapy where we are harnessing the immune cells of the patients, particularly the T cells, and enabling them to attack the cancer which is there in the patient. So it is a kind of a cellular therapy where we are utilizing the patient's T cell and engineering it to attack the cancers which is present in the patient. So CAR T-cell therapy works where we are engineering the T cells of the patients to attack the cancer cells. So every cancer, be it blood cancers or solid tumors, have certain specific expression of certain antigens, which our T cells lot of times fail to recognize. So what we are doing is we are collecting the T cells of the patients and making the T cell receptor which is present on these T cells to attack the antigen which is present on the cancer cells. When we reinfuse these T cells to the patient, these T cells identify the cancer antigen and attack the cancer cell, thereby killing it. So currently this kind of immunotherapy or cellular therapy is available against the common blood cancers, which is acute lymphoblastic leukemia, high-grade lymphomas and multiple myeloma. However, a lot of research is being done to use this therapy in solid tumors and other hematological malignancies as well. So typically a CAR T-cell therapy involves two phases. In the first phase, we are collecting the patient's T cells, which we call leukapheresis, and then these T cells are transported to the lab where the T cell receptor against the specific cancer antigen will be developed and implanted on the patient's T cells. Now these T cells are grown in the lab to sufficient numbers to attack the cancer, and then they are reinfused to the patient. So in the second phase, which is the reinfusion phase, there we are giving certain amount of small dose of chemotherapy so that we make space for this CAR T cells, and subsequently when we reinfuse these CAR T cells, they do attack the cancer cells and destroy the cancer in the body. Once we infuse these CAR T cells, we wait for the response. So typically, generally in these blood malignancies, the response takes at least from 4 to 6 weeks of time, during which we do, in case of a lymphoma, we look at the PET CT scan and see whether the tumors have disappeared or not. And in case of a leukemia, we try to do a bone marrow and look at the presence of any cancer cells, which we call it as blasts. And also we also look at the MRD, which is a minimal residual disease assay, which is done by flow cytometry to look whether even that minimal residual disease is present or not. So by this way, generally after the reinfusion of CAR T cells, we know whether it is working or not in the next 4 to 6 weeks. Subsequently, we keep monitoring for the disease based on imaging or blood tests to see if the tumor is well under control or it has recurred again post CAR T cells or not. So CAR T cell therapy, even though is a form of an immunotherapy, does have its own side effects. So the most important complications which we see is the risk of infections immediately after the CAR T cell therapy infusion in the first few days. So that is where one has to stay in the hospital to watch for these life-threatening infections. Subsequently, these patients are prone to have certain kind of infections, be it bacterial, viral and fungal. These need to be watched for, and such patients should take precautions in avoiding any patients who has cold, cough, and also maintain proper hygiene at home and at workplace to prevent infections.